guessing you also have people that are really worried about becoming addicted to something and they don't want to take it to manage it.
There have been studies on that, and taking the pain pills for pain in the early post-op period has a very low addiction percentage. It's when it goes beyond the early post-op period. It is a concern. There was a study also done looking at after joint replacement. I think it's less than 10% that patients use narcotics after the third month, which is a problem. So that is the push to reduce the amount of narcotics that patients use. The use of narcotics before surgery is really the problem. Patients that come on into the office and they say, oh, I'm taking Percocet for my knee pain, I tell them, I want you off the Percocet 3 months prior to doing a knee replacement. If you are on narcotics within 3 months of doing a knee replacement, you're more than likely to be continuing those narcotics 3 months post-op. The control of your pain post-operatively is harder if you're on narcotics pre-operatively. You build a subtle tolerance to it. It's a problem. And so that's why this whole concept of a multimodal pain strategy is important. So using things like anti-inflammatories, non-narcotic pain control helps reduce your narcotic load to the point you can get off them easier. And we have all of our patients sign a narcotic contract that, hey, 3 months you're off and you're not on it anymore. We have to kind of take the reins sometimes and be like, no mas, no more. You got to come off it. You got to go cold turkey. And what happens, they don't want to believe it, but in those patients that are having a problem with narcotics, the pain doesn't go away until you're off the pain pills, which sounds counterintuitive because in order to have the pain go away, you have to get off the narcotics. Narcotics reduce your pain, but your brain is smart enough to make more opioid receptors. Then you have to give yourself more to block that pain receptor, which is stimulated by your pain stimulus. So you got to get off the pain pills so then you can reduce those opioid pain receptors in your brain that you're upregulating because you're on the narcotics. That's why you get resistant to narcotics.